Hello everyone, I hope all are fine. Today we will start our first workshop in the Pediatric Intensive Care Unit, Chapter 1. Actually, I prepared this workshop to be like fast review for a clinical pharmacist in pediatric population and to be as basic knowledge and most important principles for the freshly graduated clinical pharmacist or undergraduated pharmacy students. I prepared this workshop from the American Board of Pediatric in addition to my clinical experience in the pediatric hospital. Today we will talk about some topics which is most important condition happened in the PICU ward like a shock and to know the different types of shock, how to manage each type and what is the best proper utilization of sedation, analgesics, and neuromuscular blocker medication, how to avoid delirium in PICU, ECMO mechanism, and how to deal with the medication, dosing adjusting through the ECMO circulation, cardiac arrest, and the difference between pediatric and adult, traumatic brain injury, what's the meaning of cerebral perfusion pressure, which is considered the most important tool while managing pediatric has this condition, the fairness, how to calculate the fluid for a pediatric which got burned, and some clinical board traps. If we start with a shock in a simple term, organ dysfunction due to tissue necrosis, due to lack of oxygen, hypoperfusion happen, so the tissue not receive adequate amount of oxygen, which cause organ dysfunction. There are four reasons cause hypoperfusion and lead to a shock condition. Before we go for each reason, we need to know first some clinical terms related to cardio. Here, we can consider this is the blood circulation. We have the heart pumping machine. We have preload amount of blood returned back to the heart through the venous return, vena cava, and afterload amount of blood pumped or ejected from the heart through the aorta to the remaining of the body. In the normal condition, you will find that the preload almost nearly equal to afterload and contractility in the normal range. Contractility is the ability of heart to contract measured by heart rate, amount of heartbeat per minute. Actually, the relation between all of them, it will consider an important knowledge to differentiate between the different type of shock because according to your understanding the different type of shock and the reasons, your management will differ based on that. First, in normal condition, we talked about it, but before we go for another condition, we need to know some clinical term. In the diastolic volume, the maximum amount of blood filled or fills the ventricle during the diastolic. In the systolic volume, the amount of blood remaining after systolic or after contraction of the heart. Stroke volume, amount of blood pumped or ejected by the heart in 1 minute. Ejection fraction, this is the proportional or percentage of the amount of blood pumped or ejected by the heart to the amount of blood remaining after ejection or after systolic or contraction of the heart. Actually, through the ejection fraction, this is the most important tool to evaluate the ability of the cardiac muscle to contract in a proper way. If ejection fraction more than 655 or 60% almost, it means that the heart in a good condition. Less than this, it means there is risk of heart failure, either systolic or diastolic heart failure. We will talk later in the cardiac chapter. Pressure of aorta. This is the pressure, BAO, pressure of blood in the aorta artery, and it measures also the afterload. Cardiac output. This is also most important tool to realize the type of shock which I have. This is the amount of blood pumped by the heart through 1 minute. I will not go for further details because I expect that most of you know these terms, but I want you to highlight 4 different types of cardiac condition and the change which happen in these parameters. Here in hemorrhage, for example, in preload, you will find that in hemorrhage patient loses, sorry, patient already lose blood or dehydrated. So the amount of preload, of course, will be less. Then the heart will contract more to increase or compensate this loss of blood or fluid. So the afterload will be more and contractility also will be more. If you find here, you will find that ejection fraction become more and the aortic pressure also become more and the diastolic volume become less because the proper amount almost to end the diastolic volume 120. If less than this, it means that patient suffer from hypo hypovolemia and can lead to hypovolemic shock. Cardiac output also increases and the stroke volume. If you go for chronic hypertension, for example, you will find that preload become more, but the afterload much more than the preload, and contractility, it is in the normal range. This will explain why some patients have hypertension, although their heart rate is in normal range. You will find here that aortic pressure, which is more, and this is reflect the afterload. Ejection fraction will be less, and stroke volume also will be more. In case of exercise, for example, you will find preload is more and the afterload less and the contractility is more, and this considered the best condition for the heart. Because of this, most of cardiac guideline advise to make exercise minimum 120 minutes per week to keep the heart in its best condition and decrease the sudden death rate to 40%. In heart failure, the first tool or parameter I need to check ejection fraction, you will find here 38%, which means the amount of blood. If we play it, you will find here in the heart failure, see the heart not contract completely because there is blood congestion inside the heart. Because the heart muscle is congested with blood, amount of blood remaining inside the heart more than the amount of blood ejected or pumped from the heart. So this cause the afterload will be less and the fluid overload or blood congestion happened can lead to later on to pulmonary also congestion and some edema. But if you found in case of hemorrhage, the movement of the contracted of the heart, see the heart is pumped more faster to compensate, as I said. In case of exercise, you will find here the heart refill with blood and at the same time pumped to the maximum or contracted to the maximum in systolic to pump or eject most of this blood, and this is the best condition as we said. In case of chronic hypertension, you will find that blood, uh, the heart filled with blood, but the pumping is more, the afterload is more. By knowing these terms, you will can differentiate easily the type of shock and also the condition of the heart. This will be more helpful in the chapter of cardiology.